Thank you, Duna. Today we have Lisa Santiago with Halifax Community College. She is the Dental Hygienist Program Administrator. And we have Miss Dorcas Eason, who is a former student at Halifax Community College, who also teaches there part-time and works with Lane Associates Family Dentistry. So thank you guys for joining us this morning. I have a few questions for you. I'm going to start with Dorcas. What made you decide to pursue a career as a dental hygienist?
Well, wanting to be a dentist and wasn't able to get into dentistry, hygiene is the closest I can get to do what I really love. So I chose this career because I really like teeth and I really like helping people have a great smile.
Oh, that's wonderful. And so, Miss Santiago, what makes the dental field a great career choice for students to?
Well, as you heard from Miss Eason's statement, we love to help people. If you're the type of person who likes to help people to get healthier, self-esteem to get better, because a lot of people, they don't smile because, you know, the way their teeth look, but we can help people to attain good oral health and overall health by doing what we do. I think also if you're into science, there's a lot of science in dental hygiene, and the pay as well. Hours are great. We're not like nurses where there's a third shift, overnight shift, so we have regular working hours. So there's a lot of benefits to dental hygiene.
Yeah, that sounds awesome. And look, we can see lots of activity happening behind you. Can you give us an idea of what they're doing?
Well, these are our first year students. This is their second semester, and pretty soon they're going to see patients from the public. So usually after a long break, which they just had winter break, we like to get them warmed up and trying to remember the procedures and everything like that. So today they're going to be working on each other as if they were working on I don't want to say a live patient because they're all live patients, but you know, somebody from out in the public. So we're just kind of getting them used to patient care, the steps that need to be done. So they're getting everything ready right now.
That sounds awesome.
Still trying to I had to, one of our faculty had an accident on the interstate. So I was sitting. Yeah, she's fine. So I was sitting with her till
Dr. Galvin.
tow truck. Oh shoot.
So Miss Easton, what was your experience like going through the program, and how did it prepare you for your current job?
Going through this program, you know, you do all your prerequisites and you come in, you think you know it all, and you'll breeze through, and then you get into the nitty-gritty. It's tough. It's not easy. There's no easy school. But you get all the help you need. I got all the help I need. Whatever I can't go through, we have a lot of instructors that will help us step by step to get through the program. Just all the little stuff that we have to do to be able to see a patient helps us prepare us to be excellent in the office. So I really, really enjoy my time in this program.
That's awesome. You must, because now you're back helping teach, right? So that shows how much you enjoyed it. Miss Santiago, can you talk to us about the difference between the dental hygiene program and the dental assisting program that you're about to begin?
Yes, in the fall, we're going to be starting our dental assisting program, and there is a difference. If you ever go to a dental office, you're going to see there's lots of moving parts happening, different people doing different jobs. With dental assisting, what you can do is you're there to assist the dentist with the procedures that he is performing for the patient. You are setting up the room, you're getting the patient, doing medical history, vitals. If you're getting a filling done, the assistant is there to assist the dentist while he's filling up cavity. So you're there to assist the doctor. Now for dental hygiene, it's different because we are considered the preventative people in the office, and we're more one-on-one with the patient. We really don't have the work with the doctor too much other than when the doctor comes in for an exam. So we do more direct care. We're also licensed, where a dental assistant is not necessarily licensed, but can if they choose to.
Got you. Okay. Thank you for explaining that. Miss Eason, can you tell us what a typical day looks like for a dental hygienist? If you're at work, doing dental hygiene, what does that day look like for you?
So a typical day at the office, you'll go in the morning, huddle just like everyone else with the doctor and the assistant, the whole staff. Now you're going to repeat your task over and over again, but it's different patients, different mouths, different people. Everybody comes in with different health situation, and you're going to see that as an individual. You also have to participate in sterilization, the good well-being of the office. So you work hand in hand with the dentist, because sometimes the dentist relies on you to see other stuff in the mouth and relate it to him. He's coming in for an exam, maybe 10, 15 minutes, but you're with the patient for about 30, 45 minutes, talking to the patient. So it's kind of like you get to know the patient more than the dentist. So you are the dentist's eyes and ears as well. Our job is very important, because without us, they can't even have a schedule sometimes. People would love to come in to see the hygienist to get their mouth clean. And then we find out, oh, they have a cavity somewhere. And at that point, they need to see the dentist. So that's a typical day for me at the office.
Awesome. Thank you for sharing that. Miss Santiago, can you share what students in high school can do to prepare for
Oh,
this
great
role?
question. Great question. I would say take your sciences. Know your anatomy and physiology. Know your biology. Know your chemistry. That is really, really important. One of the other things that I think is very important too, which is actually part of the program, is things like sociology and psychology, because you're dealing with people. And there are people who don't like to go to the dentist, and we are trying to give them excellent care. So we kind of have to help the person as far as getting him through the appointment, if you want to think of it that way. And I think one of the great things about dental hygiene is we build a rapport with our patients, and they're almost kind of like family, and sometimes we're their psychiatrists too. They tell us things that maybe we didn't really want to know that, but you get that bond, and it's a great thing. It helps you to keep coming back to work and enjoying being in the office and the people that you work with and help and provide services for.
Yeah, that's awesome.
Science, sociology, psychology.
Gotcha. Thank you. Miss Eason, what advice would you give to students who are still in middle or high school who are interested in this career?
I would strongly encourage them to just learn how to listen, be a good listener, because people are coming in and they're going to tell you everything. That's not what you're going to focus on, but you have to listen and just be passionate to human beings. People are coming. You can't see pain, but you have to believe what they tell you. And just be honest. Whatever treatment they need, you need to be honest and let them know and not sugarcoat it. Because sometimes we want to make them feel good. So those are some basic skills they need to learn. And just how to communicate clearly to patients so that they know what you're doing, what you're going to do, and what they need. If they really want to pursue this career, they need to be comfortable doing the same thing over and over and over and over and not get bored. try to make it fun in your own way.
Oh, that's great advice. And I just want to say, you guys tag teamed that really well. You talked about those technical skills or classes that are important, like the sciences, but you also talked about those soft skills or those employability skills like communication and integrity. So thank you for hitting on all of that. All of those are important. Miss Santiago, I hear that you guys have some services that you provide to the community. Can you talk a little bit about that?
Absolutely. As you can see behind us, we have a clinic and we do see people from the public. It's great because it gives our students, we have first year students and second year students. Right now, currently, our second year students are getting ready to take their boards. They have to take a national and a clinical board. And for the clinical portion, our patients are giving them experience to where when they take their boards, they're going to be successful. Also, they're going to know what it's like to work in a private practice because it would be very similar. So we're actually preparing the students as if they were working in an office. So the thing is if you're a patient here, you're not in and out in an hour because we are a learning facility. So we ask people to understand that it's going to take a little longer because the students are learning, but we pretty much say, because you are giving us your time, we're not going to make it expensive. So if you want a dental cleaning, it's only $25. If you
Wow.
want x-rays, $10 for each type of x-rays. So I think it's a great cost. It's serving the person that's coming in being treated, as well as helping those students out to learn and experience so that they can be great dental hygienists.
Yeah, that's a great service to the community for sure.
It is. And they can go to our website and they can actually call and make an appointment, and they would love to have you here.
Yeah, awesome. So, Miss Eason, now that you're a part-time instructor, what do you enjoy about teaching and staying connected to the program?
I really enjoy seeing the students learn new things, and just when it clicks, it's just a joy that you can't explain. Just to see young people being so interested in what we love to do, it's a joy to see them. I really like learning new technology because in the dental field, things change every month, every year. We have new technology, new instruments. So it's a joy to come back and learn with the students.
Wonderful. Thank you.
And we love
We're
having her too.
Yeah, I know you do. That's got to be great to have your students want to come back and be part of your program. So we only have 2 minutes left, but let me ask, what's one thing, this is a question for both of you. What's one thing you wish people knew about careers in dental hygiene or dental assisting?
Oh, I just wish that people know how important it is to their whole body health, that our mouth is very important, and that more people will be interested in coming and learning and helping others know about it.
Right. And if you enjoy working with people, helping people, celebrating whenever good things do happen when you help that person, it's a wonderful feeling. Yeah, it to me, it's been a very fulfilling career for over 30 years. So, and I was a dental assistant before. So
Okay.
I enjoyed that too. But the reason why I went into hygiene is because I wanted to do more. I wanted to expand myself and grow.
That's wonderful. So we have less than a minute left. So just tell our students how they can learn more about this program if they're interested. Uh-oh, I think they froze. We are having a day of technical difficulties, aren't we? Well, I think we
Randy,
might have, huh?
Can I just fill in? All they need to do is go to Halifax Community College, to the website, and they can talk to someone in admissions, and they will help them figure out what the steps are to get admitted to the program.
Thank you, Duna. And we've also shared some information with your teachers that they can learn more or help you learn more, share with you to learn more about dental hygienists. So thank you all for your time today. We are out of time now, and we are gonna, we've recorded this, so we will have it up on the YouTube channel soon. Hope you all have a wonderful rest of your day.